communication is? Do you think it is paramount to the success of a procedure, or do you think as long as the patient takes their meds, listens to the doctor or speech pathologist, do you think that's fine? Or do you think communication with the patient and building that rapport will lead to a much more successful procedure?
That's a huge question. I think communication is very important in the very beginning of treatment, or before treatment even starts, because a patient has to be able to make informed consent. Yeah. And in order to do that, communication has to be effective. They need to be very educated on, what they're embarking on. Yeah. Beyond that, I think it would depend on the discipline. So I think that communication has a direct impact on a speech pathologist's ability to, treat a communication disorder. Yeah. Okay. Communication is not as important when a patient is under general anaesthetic.
Of course.
It's so as far as directly impacting treatment success, I think it would depend on the discipline. Okay. Effective communication, I think, would have a direct impact on the patient experience and how the patient feels, and I think that can definitely impact recovery and patients' motivation in rehab. So it's a huge question. You could go on about it, but yes, I think it would have a direct impact.
So I'm right in saying that you think if you go in with a bright, open attitude, build that rapport with the patient, they're more likely to correspond with your advice because they feel a connection with you and are more likely to trust you.
More likely to be compliant with what the treatment requires. Yeah. For sure, yeah.
So from that, would you agree that non-verbal communication is just as important as verbal communication? So like your body language, your tone, the way you communicate the information, do you think that is as important as the communication in itself?
I think it's an extremely important complement. So, what you are saying to the patient is essentially, the message that you're trying to convey, you're giving them information. Yeah. But I think that non-verbals have everything to do with how the patient receives that information and how they interpret it. And, so I think they both have a very important role to play. Yeah. I couldn't necessarily say that. Well, I can say that one is more important than the other because you can't just go around with non-verbals. That doesn't get a lot accomplished. So,
no, of course.
Yeah.
But pretty much.
But I think it's essential that the non-verbals are there.
So they complement each other. Okay. Do you being a speech pathologist, you would have to communicate with with a variety of patients as well as a multidisciplinary team. How do you go about... there would have to be a difference between the way you would communicate with a really old man compared to a teenaged girl. How do you sort of go about? Do you ever experience any barriers with the way you communicate with them, or?
So this is just patients, or are we talking?
Oh, sorry.
Are we opening it up?
Sorry, as well as a multidisciplinary team, because for a patient, you would not dumb it down, but you would sort of have to simplify...
Layman's terms.
Yeah. Of course, that's exactly what I mean. So you'd sort of have to speak in layman's terms towards a patient, but with the multidisciplinary team, you'd sort of have to buff it up a little.
Yeah.
Do you ever find yourself getting confused, like a patient misunderstanding you, or...
As you said, layman's terms are extremely important because you want the patient to understand what you're saying. Yeah. And they're not going to understand, they're not going to understand what you're saying if you're using all of these medical terms and all of this jargon that they've never heard before. So it's important to translate that into a language that they can access. But it's also important to be able to communicate with the multidisciplinary team in a way that conveys the complexity of the information that we need to share around. Yeah. And in order to do that, you need to use very specific terminology and very medical terminology a lot of the time, because otherwise things will get lost in layman's terms. You need to be quite specific.
Okay.
Yeah, and that's just as important when communicating with a multidisciplinary team as it is, as layman's terms are when you're communicating with the patient.
And so there's a difference there. Do you find a difference between communicating with, say, as I said earlier, an old man or a teenage girl? Do you have to vary the way you talk to them, or?
Yeah, of course. And I think a lot of that comes naturally to people. You will naturally alter your discourse when you're talking to someone from an older generation. Being for example, being respectful of, cultural things. What am I trying to say? Things that they're familiar with,